Greetings from Washington, D.C. It's the day after Election Day, 2012. I'm Peter Thomas with the National Association for the Advancement of Orthotics and Prosthetics, NAAOP. Here to tell you a little bit about the election and the impact and the implications for orthotics and prosthetics. After billions of dollars were spent over the course of the past election cycle, basically in Washington it's the status quo. As people know, President Obama was reelected for a second term. The Senate remains in Democratic control with a pickup of 2 Democratic seats, expanding their majority to 55 to 45 Democrats to Republicans in the Senate. And in the House, there's about 6 or 7 Democrats who won re-election over Republicans, a net gain of about 6 or 7 House seats, with some House races still too close to call. But ultimately, the House remains in Republican control, as it has been for the past 2 years. And so, divided government, very much similar to the makeup and the political dynamics that occurred over the last 4 years, or at least the last 2 years. And we'll have to see exactly what that means for public policy, in particular 3 main areas of public policy. Reform of entitlement programs like Medicare and Medicaid, presumably in the context of larger budget negotiations. Ultimately, implementation of the Affordable Care Act, and finally, O&P specific policies. Before I get into those, let me just talk about a couple of individuals that we will be welcoming to Washington, and some that unfortunately will no longer be here. Let me start with Bob Kerrey, former U.S. Senator and Governor of Nebraska, in a hard-fought race in that state. Unfortunately, did not prevail, and so Bob Kerrey will not be coming to Washington. It's unfortunate because Bob Kerrey is a real champion of O&P care and the O&P community when he served in the U.S. Senate. He's a below-knee amputee and served in Vietnam. And was a real champion of ours, and we regret the fact that he will not be with us in Washington going forward. Congresswoman Berkeley, who was running for a Senate seat in Nevada, was narrowly defeated. Congresswoman Berkeley is the chief sponsor of the Medicare O&P Improvement Act in the House, and unfortunately she will no longer, or she will not be in the Senate next year. Also, with respect to veterans issues in the House, Bob Filner, the chair of the VA committee, the ranking member currently of the VA committee, and Congresswoman Burkle, the chair of the House VA subcommittee, a Republican. Both of them will not be in the next Congress. Chairwoman Burkle was defeated in her district in New York, and Bob Filner has run for San Diego mayor and is leaving the Congress. And so that was the committee, and those were the 2 people who were very, very interested in prosthetic care through the VA. In fact, Bob Filner was the chief sponsor of H.R. 805, a bill that NAAOP really spearheaded, called the Injured and Amputee Veterans Bill of Rights. And so we'll have to see next Congress exactly where that legislation goes. Finally, let me brief you on the election of Tammy Duckworth, an Iraqi veteran and amputee and a prosthetic user out of Illinois, who ran a tough race and will be coming to Congress next year, and we look forward to working with Tammy Duckworth and trying to do all we can to work with her on O&P care, O&P issues, as well as issues that impact the broader disability and chronic illness community. So let me get back to the policy issues. The first being Medicare and Medicaid. There were proposals to block grant Medicaid and to voucherize the Medicare program in the future. The momentum for those proposals will clearly lose steam as a result of this election. But Medicare and Medicaid are not out of the woods. There will be significant efforts to try to reduce spending in these 2 entitlement programs through the course of the budget debates that are soon to occur, both at the end of this year in the lame duck session, as well as presumably early next year if Congress is not able to agree on a long-term debt reduction package. Next, health care reform. Mitt Romney campaigned on a repeal of health care reform and a replacement with some portions of that legislation in addition to other provisions. That will clearly not happen. Health care reform or the Affordable Care Act will be implemented. It may be delayed. There may be some trimming of the subsidies, the federal subsidies for individuals to purchase insurance in order to save some dollars from the federal fisc. But ultimately, the Affordable Care Act will move forward and be implemented. In fact, we're expecting a flurry of regulations to occur and be released by CMS and HHS very soon, including the regulation on the Essential Health Benefits Package. And finally, the O&P specific legislative provisions. The O&P Medicare Improvement Act obviously is a bill that would link payment to qualifications under the O&P benefit under Medicare. It's an important piece of legislation, and loss of our champion in the House, Congresswoman Berkeley, is obviously a setback. However, AOPA informs me, and we've been talking, AOPA has already secured another champion for that legislation if it needs to be introduced in the next Congress. Also, the veterans issues with respect to the Injured and Amputee Veterans Bill of Rights, that is legislation we'd like to try to continue to move forward. It's so important, and yet our main champion, Bob Filner, will not be in the next Congress. So we'll have to reassess where we go with that, try to identify a new champion, and to try to move forward on that legislation. I hope this has given you just a little bit of a summary of where the election stands in terms of the O&P community, and I look forward to our next webcast. Thank you.